Thank you, everybody who has tuned in tonight for what is the third in our panel series for this month, the Vagina Dialogues. I have to say, and I have said this about many of the panels, but this one is particularly special for me because this really is the topic that has informed the entire campaign itself. And so I'm really, really excited to welcome an incredible lineup of women who are really, in their own individual and unique ways, helping shift the conversation around gynecological health in Asia. So thank you so much for being with us tonight, panelists. For those of you who don't know, I am Olivia and I'm the founder and CEO of Luna Naturals. We are Asia's social impact period care company led by women. And our mission is to make periods better for our bodies, our planet, and our sisters in need. Now, I just wanted to share exactly why we felt it was so necessary as a period company to host a campaign and a panel like this. So since 2015, I have been researching attitudes into menstrual health with women across Asia. And through that, I uncovered the myriad ways that taboos around our bodies continue to affect women and girls today. And there were so many women through this journey who were suffering or had suffered from common gynecological health issues, but who were confused and frightened and scared and ashamed. They didn't know where to turn. They were misdiagnosed countless times and dismissed oftentimes by family, friends, even medical professionals, until these symptoms of their gynecological health issues worsened, having really, really devastating consequences. And for me, it really goes to highlight just how deeply menstrual stigma affects our lives today, in the fact that in so many cases, these women's symptoms were dismissed as just bad periods. And we'll talk more about that later on today, because we have, amongst everybody on this panel, we have Riva, who can speak very powerfully about her firsthand experience of being dismissed for this very reason. So I just want to start by saying that I know that there is so much work to be done when it comes to tackling the taboos around gynecological health. I am so furious when I talk to people within our community who suffer from these issues about the status quo around our bodies that still exists today. But I am so hopeful through the contributions from our community members, like everybody that's tuned in today to listen to this topic, and through the work of women like those on our panel. I am so hopeful that we are going to be able to shift this status quo for ourselves, our friends, and future generations of women to come. So thank you to everybody that is here tonight helping us do this. Tonight, we are going to be splitting our panel into 3 sections. It's going to happen very casually, organically. The first, we are going to really contextualize these issues with the view of discussing them in an Asian context, topics such as cervical cancer, Pcos, and endometriosis specifically. We are then going to hear some actionable advice from our doctors, Dr. Zara Chan and Dr. Ruth Lee, about how we can potentially manage these symptoms or these issues, or really empower ourselves to have more ownership of our diagnoses. And then we are going to talk about how as a community we can tackle these taboos within our own groups and our communities as well. So that's enough from me. I am delighted to introduce our panelists. I will allow them to introduce themselves. Zara, would you like to kick us off?
Yeah, sure. Thank you. So I'm Dr. Zara Chan, and my specialty is obstetrics and gynecology. So in obstetrics and gynecology, I would say 99% of the time I am dealing with women. And there is that extra 1% where it's not dealing with women, and that reason is because a lot of women have partners, and most women have partners that are men. I wouldn't say all. And so sometimes I also deal with the male partners as well, depending on what condition it is. But yeah, so I'll talk to you a bit more later on about some of the things that, that Olivia talked about.
Thank you. And I know there's so much that can be said, Zara and Ruth, indeed, when it comes to managing symptoms from a medical perspective. So obviously we can't dive into too much detail tonight, but we will try and give some hacks and an overview of what we can do. Katharina.
Hi, everyone. Thanks for having me. I'm very excited to partake here, especially since obviously Zara and the Karen Foundation have worked together. So that's great to see us together working tonight. And hi to the other panelists also. I run the Karen Foundation in my daytime, otherwise in the night. I'm mostly mother to 2 kids under 4, so they keep me up at the moment. Lovely to have a T9 and no support at home, so that was my morning. So this is exciting to do something fun tonight. At the foundation, I'm really mostly concerned about bringing our cause out. I always say this is not about me. And very often people also think I'm Karen, but I'm not Karen. My name is Katharina. So Karen was a young lady working for a hedge fund. And that's in her legacy. We were established 8 years ago, but we get to that a little later. But yeah, I'm excited to hopefully create some change around the issue of gynecological health and making gynecological cancer more accepted in the community. Thank you.
Thank you. And I'd like to add that Katharina is absolutely somebody I admire so much in this space. I've seen her at work. She brings together what can oftentimes be very conservative representatives from companies, but very powerful individuals to get them united in supporting this mission, both financially and from an endorsement perspective. So I really admire so much that the work you do, Katharina. Thank you for being here tonight. Riva.
Hi everyone, thanks so much for having me, Liv, and Luna as well. My name's Riva. I am a freelance writer based in Hong Kong. I was diagnosed with endometriosis about 10 years ago, so I've been living with it ever since I got my first period. I have painful and really debilitating periods to the point where I have to just kind of stay home and rest. And after I met Liv, I kind of realized that speaking out and talking about my experience could be beneficial to a lot of younger women, especially those from ethnic minorities who may not receive the sexual health education that they need to realize, you know, that this could be an underlying health symptom. So I'll be sharing more of my experience with everyone tonight too.
Thanks, Riva. You are such a brave and no bullshit woman. I absolutely love it. I feel like you're on the cusp of starting a whole movement around this topic in Hong Kong, actually. So I'm so excited to hear from you later. Thank you. And Ruth.
Thank you.
Hi, everyone. This is Ruth Lee from Balance Health Wellness Center. I'm a registered Chinese medicine practitioner and acupuncturist. I used to practice in Beijing and Shanghai. Now I come back to Hong Kong, where I was born and raised. I specialize at women's health, treating conditions like infertility, irregular menstrual cycles, or menopause syndrome, as well as different skin conditions like eczema, acne, or hyperpigmentations. And also sometimes some clients come to me for cosmetic acupuncture. And I always treat them not only locally on their face, but also holistically applying needles on the body points, or sometimes prescribe herbal medicine to regulate the overall system balance, both physically and mentally. It is because that Chinese medicine always treat illness in the context of the whole person, like the body, the mind, the spirit. So tonight, I'm very honored to be invited to join this panel discussion, and I really like to contribute from the TCM perspective on how we see the different conditions with a holistic view. Thank you.
Thank you so much, guys. Okay, I'm going to stop sharing my screen so we can see all your faces. Perfect. Let's get going then. So I think it's, considering we want to frame the context of some of these diseases and disorders, specifically with a view of Asia, I was hoping, Katharina, you could actually explain to us firstly why the Karen Lung Foundation exists, not just so we can hear more about your work, but because it feels to me like the story of Karen Lung is really demonstrative of the story of many women today. Could you share with us more about that, please?
Sure. Well, I think the easy answer to that is, I think Karen had this fate because too little was talked about cervical cancer specifically, or as a whole. We look at gynecological cancer as a foundation, but ultimately, Karen was diagnosed with stage 3 cervical cancer very late and died within 8 months. Would she have known more about symptoms of cervical cancer or how to prevent cervical cancer, i.e. through a HPV vaccine, she would have maybe survived. So it was really her who said to her husband back then, look, I do not want this fate to happen to any other young women in Hong Kong. And I realize how also being an Asian woman may have contributed to my fate, i.e. I didn't have any sexual health education at school, or it wasn't really much talked about in my family, etc. So I would like you guys to set something up in my legacy. So it was her husband and her employer, where I'm now sitting in their offices. They have donated their office space to us since the 8 years which we're in existence, that we do what we do. And really our mission is to not just dabble in the space. Yeah, we really want to make an impact in the reduction of cervical cancer in Hong Kong. And we started our work by looking at the low-hanging fruits. And what were the low-hanging fruits was that there seemed to be no national program around the HPV vaccination. And the HPV vaccination is really a vaccine which can prevent cervical cancer quite effectively, yeah, and very easy. Of course, I mean, I was just looking at some figures. There are obviously numerous reasons why there was the uptake rate of cervical cancer vaccination here, or against cervical cancer, is below 10%, between 7 and 10% of girls have only been vaccinated. We hope to see a shift upwards now that the government has implemented the vaccine. So that was one of our big changes, or which we are very proud of. But obviously that was a road of 8 years, or 6.5 years. So we started, we went to see UHK, we said, look, let's do the study together. Let's look at what would increase the uptake rate of cervical cancer vaccination, i.e. HPV vaccination. We co-authored the study, we published that in a Harvard magazine together with UHK, and we went to LegCo and petitioned actively. So that a little bit as a snapshot of how we started and what our mission is. And obviously we continue with the various programs around awareness, prevention, care and support to hopefully make that impact.
Amazing. And sorry, Katarina, can I go back? Can you remind me how old Karen was when she was diagnosed?
She was 35 years and she passed just before her 36th birthday. She had just got married. We're planning to have kids. So definitely, I think an age group, obviously she was very busy, right? I mean, hedge fund trader, working in the CBD, didn't have time to go out to get a health check done. And I think when we look at our research and obviously also the feedback we get when we do health talks and so forth, I think time, convenience is always something we hear why women do not go and do their cervical screening test. So cervical screening is around 40% of women have never been screened in Hong Kong. Uptake rate of a government screening program is at about 20%. So very, very low. So at the moment, we're actually running a new project with the Hong Kong University, HKU, around trying to assess the factors of how could we bring the screening rate up, and whether there would be other methods of screening, i.e. self-testing. HPV self-testing is now an available method. It's not recommended by the Hong Kong government at this stage, But is there something we can do? And I think COVID-19 is actually a really, really good reminder that we need to maybe think outwardly, how can we change the way we look at our health overall, our well-being, and take actively charge of it and making it convenient for the average woman or for the ethnicities out there which are not even allowed to see a male doctor, or where it's really taboo. Is like a self-test maybe the way to go? And is that something the government should recommend, to increase those screening uptake rates and end up with lesser cancer patients / lesser mortality in Hong Kong overall?
Now, I just want to pause there because you said so much great stuff. Now, women aren't getting checked you mentioned convenience, right? We live busy lives, we don't prioritize this. Now, that's sort of how sometimes we might approach like our dental health, for example. But obviously, aside, like linked to that is the fact that we aren't aware perhaps of how significantly getting screened can save our lives. Like fundamentally, you know, I think when I talk to a lot of women actually and men about this topic of cervical cancer, I think there's this overall feeling that it's not a priority to get these screenings. Yet when you hear stories like that about women like Karen, and I think her age is significant, like 35 is so young. And I think why is it that we don't prioritize this as something that could save our lives?
Well, I think in my view, obviously this is what the panel is about, right? We talk too less about the topic. And I mean, I think one of the things I've seen over the 4 years that I've run the foundation, I always like to say the topic or our mission doesn't make much of a lunch or dinner conversation. And Sarah would have heard that in one of our early panels a couple of years ago where Sarah was contributing. Yeah, I mean, it's really, I go to a dinner party, people say, oh, what do you do? I said, oh, well, I run a charity. Oh, what do you do? Oh, gynecological cancer. They said, excuse me? I said, yeah, you heard right. Female cancers. Oh, female cancer. So you mean down there? So, you know, obviously, it is really something, how do we shift the conversation to become normal? Yeah. How can we include it? I actually feel it should be like going to the dentist. Yeah. So we have run several campaigns now where we like to call it prioritize your health, but make it a normal, like a birthday party or, you know, like a date night with your husband. Yeah. It shouldn't be that, ooh, this is an extra add-on. Yeah. So we want to actually make it a normal, regular, that's, yeah, just like the annual dentist checkup.
Yeah.
We now at the charity, and I mean, we're really excited about this project. We are now utilizing this year the arts as a medium to help us communicate the topic without talking about it. So later on this year, we are in the process of onboarding artists, which will submit pieces around the celebration of the female body and empowering us women to talk about our own needs, feeling self-confident, loving ourselves, and therefore creating an ordinary act of self-love, yeah, and including that. So we will see how far we get with this project. We have got high hopes to kind of, through utilizing something else rather than an image of a vagina on a PowerPoint, to kind of chat, hopefully, or get younger women to hone into the topic and do their own research rather than saying it, hey, here's a vagina, this is what you need to do, and you should do this once a year. Yeah. So I think this is kind of the approach we're looking to take to overcome some of that social stigma and some of that perhaps more Eastern way of looking at gynecological health.
Yeah. And I think it's within this topic, it's the double stigma, right? Like nobody wants to talk about cancer over dinner and nobody wants to talk about like gynecological issues over dinner. So we have the kind of double whammy of having to battle to have this conversation discussed, which leads me on to Zara. Let's start with you from a medical perspective. Again, I feel so strongly about this topic because I have just met so many women, not just Asian women, but so many women who haven't got these smear tests or the screenings that they need. And ultimately, in Asia, it's a lot to do with fear and shame of going to the gynecologist. I myself have actually had a checkup. This was when I was living in Shanghai, that left me feel very, very judged and very, I'd say, ashamed and very uncomfortable. And I know that's a common narrative actually within our community. Can you talk more about why that is and how we could perhaps overcome that?
I think so. What I've really observed in my practice is for the women who have made the appointment to go see the gynecologist, those are already the women that are more knowledgeable. Those are already the ones that acknowledge the need or the importance of seeing the gynecologist, the importance of doing a health check, and also that the gynecological checkup is actually just part of a routine health check. And a lot of why people don't do it and why there is all of that stigma, it's really related to culture, society. marketing, and why I say, you know, culture. So culture is just because, you know, some cultures just don't like to talk about it. Like you said, you know, you might talk about a bump or lump that developed on your arm over dinner, and you might, you know, feel free to ask someone about it and say, you know, which doctor can I see? I've got acne, so who can I see about that? But it's like, I have vaginal dryness, who should I see? You never really ask people that. So most people then go on Google and just do what Google says, which, you know, then leads to other problems. And a lot of the times culture makes a difference, because it means that you're not comfortable to ask your family about it. You're not comfortable to ask, you know, maybe your sisters, your mom, simply because nobody's ever talked about it at home. And of course, I think how strong a female role model is at home also makes a big difference. A strong female role model at home, you know, whether it's in the form of a mom or an aunt or a sister, all of these really make a difference, because you feel more comfortable to talk to that person and just to ask them about it, and, you know, to trust their judgment. So culture makes a big difference, just whether or not you're comfortable to talk about it with your friends or people you trust. Marketing makes a big difference, because it would be really good if, you know, all the companies just put health check in a bundle and just put pap smears into it. Pap smears into the bundle for health check. Breast exam is part of the bundle into health check, but not all health checks do. A lot, depending on, you know, which company you're going to, but some companies will put health checks, just blood test, ECG. So like the ECG is for the heart. Even that is part of the routine for, you know, anybody, like 20-year-old, 30-year-old, but not a gynecological checkup for a woman. And that's always considered an extra, and it's always an added charge. And so that just acts as a barrier, because for most people walking in, they'd say, oh, okay, well, I actually have to pay for that extra bit, so maybe not. And I think, like you said, another issue that sometimes a lot of women would say as well, about how the doctors and how the medical professionals that they approach, and how they themselves view the woman, and also the complaints that they're talking about. A lot of women I see will come for vaginal discharge. And vaginal discharge, to me, it's so common, you know, I see it every day. It's fine to have vaginal discharge. It's fine, you can sit on the chair even with vaginal discharge. It's fine to have your period during a gynecological checkup, because that's just the norm. And a lot of women, I can see that, and, you know, some will also vocalize that they're embarrassed about the discharge. They don't call it the vagina. They just call it, there's just something going on down there. They call it down there. They have a lot of terminology. And the fact that there's so much terminology for it, to me, it says that they're not comfortable with it.
Yeah, so many euphemisms.
Yeah, and so, you know, people call it my flower, my hole. And so, I mean, I have 3 daughters, and so one thing that I think is really important is, you know, something that Catherine has mentioned, is just to normalize it.
Yeah.
You know,
Yeah.
you've got a stomach, I've got a stomach, and she's got a stomach. You've got a vagina, I've got a vagina, and she's got a vagina, and everybody has it. The more you normalize it, and the more you talk about it, the more everybody understands what the norm is. And so in my practice, there's a lot of times that I actually spend explaining to people what's the norm, what is outside of the normality, and when it's important to come back.
I think you've raised so many good points there. You've actually led me to think of one challenge that we can pose to our audience at the end of this panel, which I'll save for later. But I just want to touch on the fact that when we talk about healthcare, you made such a good point, and I've seen this so many times. Our vaginas are still considered extras. And until we actually try and make them part of our whole and our fundamental being, firstly, we will be light years away from achieving gender equality if we cannot have people respect a woman's like vaginal gynecological health as part of our foundational existence. And Katerina, I don't know if you'll remember this, but at one of your fundraisers, I met the managing director, a man of a large global company. And he told me this amazing story that when he found out Pap smears were not included in their employee welfare because he had a woman who had taught him all about this, his wife had taught him all about the need for smears, he demanded that HR try and push this forward. However, interestingly, he told me that it then got stuck with HR, who were predominantly local Hong Kong women and who were very uncomfortable to even discuss the topic itself. And I thought that was a really interesting contrast of this man who wanted to even implement this healthcare within his company, and then it being met by such deep-rooted cultural taboos within even the women who it was going to benefit. And I think, Ruth, I wanted to move on to you at this point, because I know Balance Health do a lot of corporate work in terms of trying to implement better, more responsible approaches to women's health and well-being within companies here in Hong Kong. Can you talk a little bit more about how we could perhaps go about having these kind of companies and society more broadly higher value female health on this level?
Well, at the moment, we are actively promoting, corporate cooperations to talk about how natural therapies can help different ladies, different women to more understand about their gynecological health. However, something that is quite interesting because you also mentioned about how we diagnose about women's health, women's different conditions, right? In Hong Kong, sometimes we don't have any access as a TCM practitioner. We don't have any access to pap smear tests or ultrasound tests or blood tests. So we just go in as a person. We use our brain, our experiences to diagnose and treat. So it doesn't really affect how we diagnose people, so it's a very simple and primitive way of therapy. So people are more and more inclined to this kind of therapies to use it as a supplement or a complementary therapies to the Western medicine. So let me give you an example. We basically, even we don't have any tools to diagnose, it doesn't really affect the way that we treat our patients because we adopt a very different approach to diagnose. It's a very patient-centered approach, and we see only disease only a result of an underlying cause of system imbalance. So we often talk to our patients asking them a lot of different strange questions like their stool, their blood color, the texture, the discharge texture, the smell, their preference on cold or hot drinks. All these questions about their lifestyle, about their signs of, symptoms can help us to diagnose, their body constitution and give them a very good, unique differentiation pattern. Say, for example, a patient come to me, she probably has Pcos, but I don't have the tools to diagnose it, right? And so, she told me that she wants to treat her infertility, and I can still treat her even though I don't know whether she is really having Pcos or, endometriosis, because I only need to understand her unique body constitution. I will, understand, if she has spotting, brownish blood before her blood goes really dark red, or, is there any pain, in their abdomen as well as the side of the torso, any pigmentation on the side of the skin, all these little signs can give us a lot of information to diagnose, okay, this person probably have blood stasis and liver qi stagnation. So we can then customize a prescription and then, give them some unique acupuncture points for acupuncture and moxibustion and to regulate their qi and blood flow so that it can go smoothly again. sometimes after a few months of treatment, you know, the patient will gain balance and the symptoms elevated and get pregnant. But then she still probably will have Pcos, but it doesn't really matter, you know? But then, you know, I would see, you know, the TCM way of seeing a condition or an illness is very different from the Western approach. But then, you know, again, I said it is complementary. It is also beneficial if the patient can provide us, you know, all the examination reports like blood tests, ultrasound reports, you know, those are very helpful information for us to understand their body type. And also it can be used as a very good evaluation tools to our treatment's effectiveness.
Got it. And so I think really there you've touched upon the complexity of obviously our bodies and really highlighting how undervalued the complexity of our hormonal health, our female health often is. I think there is so many cues that we can take from our bodies. You talked about color of blood, consistency of discharge, all of this stuff. For lack of a better word, we as society still think it's quite icky, quite gross, right? Like Zara touched upon it, like normalize discharge. Like I want to shout this from the roof, like let's talk about discharge. This is so normal, but considered so gross by so many people, women, men, however you want to identify. So many people think this is such a topic that should not be discussed. When in fact, these are the cues that our bodies are giving us to tell us whether we are fundamentally well. And I think that leads me perfectly onto talking to Riva, because when we talk about all of these social stigmas around women's health, you are a prime example of somebody who has borne the brunt of that stigma. And could you tell us more about your endometriosis journey? And let's talking about how many times you were misdiagnosed or dismissed.
Yeah, thanks, Liv. I think like all three of you guys also touched on a lot of points that I think are so important, right? Like the cues that you get and the symptoms that can actually be a sign of underlying health symptoms. I think, you know, there's really nothing more disheartening than when a doctor dismisses your symptoms, you know, and also we just need to stop normalizing period pain. When you have extreme period pain and you go to a doctor and a doctor's like, it's just your period, you know, it actually can be a symptom of something else. One of the things that frustrated me so much was like how many doctors I'd gone to tell them like, I am in so much pain, I can't sleep, I can't even sit down or lie down, I'm so uncomfortable. And they all just wake me off by saying, no, you've just got dysmenorrhea. And when I finally got my diagnosis right before I turned 18, I was, you know, very relieved to have it, but I was also really scared. I'd never heard about it before, never learned about it. And, you know, I pretty much had my experience dismissed by people just telling me my whole life, well, all women go through it, you know, it's just your period and it's just what women have to deal with. And when you dismiss an individual experience like that, it's really kind of crushing to your confidence, but also you feel so alone and you really don't know kind of where you can go from there, right? So I think, you know, it is really important to continue the discussion to break the stigma. I was taught from a very young age, you know, my family is Indian ethnically, and your period is something that's just private. Like Zara said, you know, some cultures just don't like to talk about it. And even today, I'll be like, got my period, and my mom will be like, okay, stop shouting it from the rooftops. And, you know, I think it is really important to talk about, not just at home, but with your friends, your partner, at work, or even at school. You know, growing up to feel ashamed of something that happens to you is really fundamentally wrong. And it can be really hard, but it also is just about those simple things you can do to normalize it. So, you know, for example, like normalizing period products. I had a cousin come stay with me once and he was like, oh, what's this? Like picking up my pads. And it's like, it's not a gross thing. You have a sister. If you have a sister, a mom, a partner, if you know anyone who menstruates, it's as much your problem and something you should learn about as women have to as well. And I think it's just about education, right? I talk to a lot of my guy friends and I'm like, do you know what like this feels like? And do you know what I go through? And I explain it to them. And at first they're always like, that's really disgusting, dude. But after a while, they come to understand and ask questions about, oh, so does this happen to all women or to some women? How come, you know, you went to doctors and they weren't aware of this? And I think talking about it is so, so, so important because it really does lead to, you know, change, even in the smallest sense.
Yeah, and I think your story is so powerful, and it is so similar to the stories of women I've met throughout the years. I'm sure Zara, Katerina, Ruth, you would have met so many women as well who have come to you, or you've heard their stories, who have been dismissed and time again. It made me think, and I know this is a really crude comparison, but I remembered so many girls throughout my youth, a particular girl at school who most months was genuinely like crippled on the floor in pain, and how we and even the teachers kind of just looked at her and offered her like a Panadol and were like, oh God, one of the unlucky ones, like there's just nothing we can do. And the crude comparison I was going to make is, you know, if you imagined like a boy on the ground crumpled so frequently in agony, that would never ever be dismissed as normal. And when I was talking to this about somebody, their response was, oh yes, but that's just periods, like periods can be negative. And I sort of just asked them, like, but who said that was the way it should be? The medical profession, which let's face it, has been like really conditioned to focus on like male bodies throughout the entire modern history of the medical profession. We're only now really doing research that actually is for women's bodies, using women's bodies, still in like relatively quite recent terms. And so really we don't even have an understanding, I don't think, of like what menstruation is or should be. And therefore I think the deep-rooted nature of our belief that it should be a negative experience and that being unavoidable is why so many women and girls don't get the treatment that is needed. Zara, from a medical perspective.
Just like, if I could just pop in here and just say, I think you've pointed out something that is really a turning point in the medical profession, and that is actually more women doing medicine. In Hong Kong, I can't say for other countries, but definitely in Hong Kong, in the last at least 10 years, every single year, there has always been more girls going into medical school than boys. You know, and I think that is something that is really going to bring changes in the next, you know, half a century for medicine and for women, because you can imagine that in the past, like obstetrics and gynecology, you know, half of the babies being born in general are girls, and yet all the medicine that has been practiced has always been practiced by men. As in, it was always men delivering the babies. It was men treating the period pains, and they've never really, I guess one of my issues is that they've never really been through it. And I think, you know, Riva can say from personal experience that when you've been through it, you know, when you've been through that pain, you really remember it. And you remember how, you know, at that point when you're going through it, you really wish you had an answer. And like you said, you really wish that people didn't say that it's your period, so it will be painful, and then they just write it off. You know? And I think that's really going to change, and I think that's going to change just because, you know, there are more women in the profession, and people will be speaking from their own experience more. Yeah.
That's to the point. And I think within this panel in itself, we have obviously yourself, Zara, and Ruth, two women who are really leading the charge in the medical profession, in this area. And then we have women like Katerina and Riva who are really helping actually, I think, equip women with the ability to take more ownership when they go for these medical examinations, because I think we need to have both, right? We need to have like trusted, oftentimes like female medical professionals who have first-hand understanding that we can trust. We also need to make sure that we can rely on our own research and our own understanding so that we are empowered not to allow people to dismiss us, right? I think we sometimes we trust too much in the medical professional. Does that sound like right to you guys?
Olivia, if I can pop in here, I mean, I think you're saying the word empowered, and it brings me actually back to a talk I held last year. I said, you know, the word empowerment is used so often these days. Yeah, it's all around empower women, empower them to sit on boards, empower them to be successful in their job, empower. But what about we empower ourselves and other people empower us to start with our health first? Because if you don't start with your health, you can't do all of these other items. And to Riva, to your point, I mean, I also suffer endometriosis and really badly, but I only found out 6 years ago when it landed me in the ER after I visited several OBGYNs here, and everyone said it's just normal. But I mean, by then I was on God knows how many painkillers a day, and my periods would be 15 days long. And I was very lucky that as I walked into that hospital ER, I actually had a doctor who specializes in that and said, well, what you have is endometriosis, and you have gone from over 25 or 27 years from sitting in a classroom where I said, no, sorry, I need to go now to the toilet and I can't wait until the break, to almost bleeding to death. So I'm so with you, and I think I feel, and to Sarah's point, I do feel there is a normalization coming, as people are speaking more up, women are speaking up about these things. Yet there still seems to be a lot to be done. I mean, I pulled out a stat here for the school vaccination program we ran a couple of years ago. We asked basically the parents what were their factors of not opting in. So we provided the HPV vaccination for free. So you would think everyone would opt in, obviously. So we went to low-income schools, and about 10% of the parents didn't opt in because they felt they were alluring their kids or their girls to having early sex, since HPV is a sexually transmitted disease. So I mean, that just goes to show how the educational piece around gynecological health / sexual health is really something which needs to take place in order for us to become healthy individuals when we are growing up and then therefore raising our own children, etc. Right?
Yeah, I'd love to add to this as well and just say that, we do need to push for a better sex education. Like, I remember my horrible sex education in high school and how unprepared the teacher was, and I learned from my cousin who attended school 12 years after me that it's the same. And it does need to be more inclusive, not just for the LGBTQ community, but also to include women's health, right? Like, we talked about periods and we didn't really talk about much else. I didn't learn anything about gynecological cancer or cervical cancer. I learned about testicular cancer before I even knew what endometriosis was, and I had it. And I think sex education is so important because young women need to be able to recognize those symptoms and know where to seek help if they need it. Endometriosis affects 1 in 10 women, right? So wider awareness really helps with early detection. And I think the other thing that I'm really, that makes me really angry and stressed as well is that, if you come from if you're, an ethnic minority, you come from a background that has a kind of very strict culture or religion, a lot of the time your period isn't just about a sign of puberty. It is linked to fertility because it's when you become fertile. And there's a lot of belief in Indian culture about, not going out alone because you're more vulnerable to evil spirits and all that. But it's also about, the urges that come about once you reach your age and getting to your period. And so broaching this conversation with parents can be so difficult and debilitating to mental health. You feel very lonely, you feel stressed, you feel trapped, you feel like you have to lie constantly. And sexual education at school is probably the only formal sex education that many ethnic minorities will, actually receive. And it's really important for women to be able to know, where they can go, how they can have a trusted resource, who they can talk to, and, what are different signs of something that they might need to, take more action into. And I think it's going to take a while for us to get there, but I think, it's definitely incredibly important for, education to become mandatory and also more diverse in schools.
And more engaging, can we just say? I mean,
yeah,
I think
exactly.
Katharina was also saying earlier with sort of reframing this in a more engaging, artistic way. That's really how we're going to get people talking about this. Those dusty old textbooks, those ugly PowerPoints, they're engaging no one in these very important conversations around our bodies. And also, I wanted to touch upon the fact that you mentioned you did learn about periods, but was your education the same as mine, in the sense I learned that periods was just blood coming out of you once a month? That's it. There was no context around the hormonal changes my body would go through. It was just you will bleed, you might be grumpy, good luck. Right?
Yeah, pretty much.
Did anybody in the panel, Ruth, was it the same for you when you were taught about periods, and do you know if that's changed in recent years from a
Well,
school?
I have my menopause years ago, so it's not my personal experience, but my patient's experience now. Listening to your comments about, you know, when you have menstrual pain or endometriosis, when you're really having severe cramps, a lot of people would go for oral painkillers. You know, you accept that as a norm. However, you know, this is something that we TCM doctors doesn't really want you to do, because I want you to listen to your body talking. You know, sometimes I want to ask you, you know, if you have the pain, what kind of pain? Is it a sharp pain, a dull pain, or is it bloatiness? Or, you know, there are a lot of other little symptoms that can give us a lot of information. So if you ask me, I really want, you know, my patients to pay attention to their body talking. You know, observe, you know, their menstrual cycle, observe their blood, you know, observe their skin condition, observe, you know, their temperament, you know, all these are linked to the hormonal balance, right? So these things, you know, is really important, because once you notice this is off balance, you can seek for professional help in the early stage, right? You know, besides a painkiller, there are a lot of others supplementary or complementary therapies in the world. You know, say for example, acupuncture, say for example, you know, hypnotherapy, you know, aromatherapy, or sometimes I ask my patients, you know, you do your abdominal massage, which I made a little video for you to share. You know, this is something that you can DIY at home, you know, to help you to relieve the symptoms. But of course, you know, listen to your body, and also take care of your emotions are very important as well. You know, because in TCM, we believe that the emotional activities are the major internal causes of a lot of diseases and weaknesses of our systems. You know, like according to the theory of the 5 elements, you know, the 5 main systems, the organs, are related to 5 specific emotional activities. You know, heart is joy, liver is anger, spleen is pensiveness, lungs are anxiety, and kidney to fear. So when an emotion is overwhelmingly powerful or too, you know, strong, then it will not only create psychological issues, but also damage our internal organs, and in turn, you know, cause a lot of conditions, endometriosis, fibroids, you know, Pcos, infertilities, you know. So in TCM, we always believe that emotional balance is the key to women's physical health as well. You know, sometimes, you know, somebody who has a liver qi depression, like I said, you know, there will be some pigmentation along the liver meridians, and the liver meridians go through our breasts. So sometimes some severe conditions will go to breast, you know, hyperplasia, or even breast cancers. So, you know, these are all the things that we have to educate our new generations that you have to pay attention to.
Yeah, and I think there's so much that we need to be doing, and really encouraging each other to consider this as the norm, rather than, and something that we try and build into our everyday lives and our general approach to our bodies, because I know we are all busy. I mean, Katerina said it herself earlier, like, she's a busy woman with 2 young kids. Like, sometimes we aren't very good at taking time out and looking after ourselves. But I think if we reframe it in the importance of, like, literally saving our lives in some cases, then we really need to make sure that we do prioritize this. So I want to hand over now to any questions. Audience, please feel free to speak up, send through any questions that you have. We've got some thank yous. Oh, we've got a question. Riva, can you see this one? Dear Riva, is it true that the admirable Padma Lakshmi is a big on your cause? Great job you are doing. Can you see this one?
Yeah, I can. Hi, Jana. Thanks for the question. Yeah, Padma Lakshmi is a huge advocate for endometriosis. She suffered for years, and, you know, it felt like she was completely isolated. I think it's really inspiring to have someone speak out, not just a celebrity, right? Like, there are lots of celebrities who have endo, but also someone who is the same race as you. I think sometimes, you know, when you talk about like period advocacy, a lot of the time culture plays a really big part in it. It's really hard for me to kind of not empathize, but to I guess to find commonality with things that are from more Western societies, because the reality is I am from an ethnic Indian background, and my family, you know, who I live with in Hong Kong, they are also Indian. So I think having that cultural support definitely does play a really big part in it. And she's an amazing advocate with her own endometriosis foundation as well now in the US.
Thank you. Zara, could you please explain what PCOS is?
Yeah, so PCOS stands for Polycystic Ovarian Syndrome. Whenever I explain it to the ladies that I see, one thing that I do emphasize is that there is a difference between polycystic ovaries and polycystic ovarian syndrome. You can have polycystic ovaries, but not have the syndrome. If you have the syndrome, you must have polycystic ovaries. And the reason I do differentiate it is because a lot of women will come to me and they'll say, you know, somebody else told me that I have polycystic ovaries, so do I have the syndrome? And am I going to have all of these things related to the syndrome? So polycystic ovaries is just something that we can see on the ultrasound, and just because I see it, it doesn't mean you have the syndrome. And that's very important because the syndrome is a very complex condition. Syndrome, the word typically means that it's a series of different symptoms that a person may have, and all of these together, grouped together, causes a syndrome. So polycystic ovarian syndrome, nobody knows the cause. And in a younger population, in adolescents, for example, they estimate that about 10%, 15% of young women may have polycystic ovarian syndrome. It's something that is related to genetics and also probably to things like your familial background, because it relates to things like your diet, obesity, and things like that. It's linked to many different things outside of just the ovaries. So people who have this syndrome typically will have irregular periods, and so there is some fertility issue down the line. It's also related to metabolic issues. So metabolic issues being things like liver, high cholesterol levels, diabetes, cardiovascular risk. And also then down the line, it has some association with mental health as well. Which is understandable because, you know, if you first suffered from fertility issues and then you suffered from cardiovascular issues, then that's quite a bit to deal with. And so obviously it's going to have some mental stress as well. So it is a very complicated sort of diagnosis. So personally for me, it's not a diagnosis that I make easily because it does have a bit of stigmatization. And also if people really have it, it does have a lot of long-term implications.
And you mentioned there that 10%, supposedly 10% of women have PCOS. It's, as we said earlier, the same for endometriosis, isn't it, Riva? 10% of women have endometriosis, yet the diagnosis time, at least in the West, is still 7 to 10 years. So 10 years, a decade to diagnose a disorder that 10% of women have. That's madness to me. And we discussed the reasons why earlier, but Riva, for those of our audience that don't know, what is endometriosis?
So endometriosis is, and feel free to jump in, Sarah or Ruth, if I get the medical description wrong, but it's when your endometrium, which is the tissue that lines your uterus, or your womb, grows outside of your uterus. So for me, it was growing on my ovaries, but for a lot of women, it's your fallopian tube, and even can be like your bowels, your pelvic lining, if it's like quite severe.
It could even be, I've seen it in women's lungs, and also even on the skin. So when it's on the lungs, it's it's severe being because of the location. So some women who have it on their lungs, it might be that every single time they have their period, they'll cough blood. For people who have it on their skin, every time they have their period, that patch will swell, become painful, usually doesn't bleed, but that is a skin endometriosis. So it could be very extensive.
Riva, I think this is a great question for you. What are some non-medical things you can do to manage endometriosis?
Yeah, so actually coincidentally just did a video for Luna on their Instagram as well that includes like a couple of things that I do that might help. But just briefly, I think I really believe that you can manage your symptoms more effectively if you can expect what's going to happen. So, you know, tracking what happens to you every month, like Bruce said, listening to your body, you know, the color of your blood, the length of your cycle, the heaviness or the lightness of your flow. You should know what a regular period feels like, and by tracking, you'll be able to kind of see what's irregular. Some of the other things I do, I like to stretch a lot and make sure I kind of get some type of really moderate exercise, whether it's like Pilates or, you know, just walking. And lastly, what I kind of do for my period, I spent my whole life dreading it and hating that time of month, you know, like my muscles contract thinking of when I'm going to get it. And so I make like a little self-care ritual out of my period. So I make it something to look forward to rather than something that I dread, if that makes sense. So I'll schedule like lunch or coffee with a really good friend. I'll do something that involves me getting out of bed so I feel more accomplished. And I'll just spend time with people that, you know, I'm really close to. And you do need to trial and error a lot of things sometimes. One of my friends recommended CBD oil to me, and that didn't help with my pain, but it actually helped to bring down a lot of my anxiety. So when I got pain, I'd be like hyperventilating, crying, and just, you know, in shock basically. And taking CBD really helped to ease that so I could think clearly and properly. So even if something doesn't 100% work to take away your pain, it could also just work to manage the mental health symptoms of that.
Really, really powerful, Riva. Thank you. Dr. Ruth, there's one here for you. If emotions affect our body or trigger pains in certain areas, does it mean when we consciously choose positive emotions instead of negative ones, it should make those pains go away?
Well, that's a very interesting question. Let me go back to the 5-element theory. You know, like our, you know, liver always is the system to govern our emotions, right? And sometimes, you know, it has anger or it has some agitation, you know, you suppress it, it doesn't really help. Sometimes we can go back to another layer, you know, because the mother of liver is kidney. And kidney sometimes is, you know, governed by the emotions, which is fear. Sometimes when you fear about something, you know, it will just, you know, help you overcome the anger or some depression that the liver brings to you. So that's very interesting. Sometimes, you know, joy, you know, can help you to, you know, suppress the pensiveness. You know, sometimes, you know, if you have anxiety, you can think more, you know, rationalize more, then your anxiety would go away. So that's the 5 elemental emotional theory. So you can use other emotions to help you compensate or balance, you know, the, you know, problematic emotions, I would say.
Thank you.
And of course, you know, there are a lot of other tips too. You know, you can also make herbal tea, because a lot of people always think that green tea is good, right? So everyone just go for green tea because it's good for, you know, antioxidants. You know, everybody is drinking that. Let me go back to the body type, because if your body type is cold type, say for example, green tea, chances are is too cold for your body type. So there are a lot of other herbals that you can explore to help you get back to the balance, even on your emotional side. Say roses is good, you know, tangerine peel or chrysanthemum, they're all very good to balance our emotions.
Thank you so much. It's safe to say there are so many tips that we can share, and we are going to be able to provide the resources, both those on our Luna platform and to any of the panelists here today, so you guys can actually get more information about specific issues if you need them. Because we're coming to the end of the panel time, I do want to finish by having each of our speakers really share a call to action or some advice to our audience that can really allow us to inspire our wider community to drive conversation and make change with regards to this topic, and create more openness and awareness around gynecological health. Riva, is there anything that you want to share?
Always. I think from my end, one of the things I want to say is that I know endometriosis can be so debilitating and so lonely, and it can really, take a toll on your confidence, your mental health, especially when you have that disruption. And, like Katharina said, it gets to a point where it's a climax of, something really scary for you to actually find out. But just knowing that you're 1 in 10 made me feel a little bit better. And, there's always resources and support. I'm always open to talk to anyone who has endometriosis and maybe just wants to have a fellow kind of endo sister out there. And I think the other thing is that no matter, who tells you what's going on, and if a doctor says to you, like, it's just your period, it could not be. So just listen to your body, trust your body, because you know better than anyone else, and demand better because you do deserve better. Yeah.
Amazing. Thank you. Katharina?
Well, I mean, out of personal experience, I would say call to action is start with yourself. Either talk about it, whatever you feel you need to talk about, or if you have some symptoms, go check it out, because I was there a couple of years ago when I was already at the helm of the foundation. I said to my husband, I mean, something is wrong, but I wouldn't go because I was afraid what the diagnosis would be, and it was a reoccurrence of my endometriosis. And I thought, I mean, if I can't even go, as the executive director of my foundation, which looks after gynecological cancer, how about others? So I can only encourage you, if you feel something is wrong with you, go and get it checked, just for peace of mind. Generally it can be fixed, and if you do it early, for sure it can be fixed.
Amazing. Thank you so much. Zara, what would you like to add?
I think the main thing is, I usually tell if you guys have any discomforts and it's a question, then go see somebody about it. Because yes, there will be medical professions out there who, as you guys have experienced personally, who brush it off. But I think there are still a lot who would not brush it off. And I think if you went to see a doctor and then you brought up your concern that, that you have polycystic ovaries, or that you have endometriosis, or that there's just something wrong, and then, to ask them to do a thorough check. And I think that would get you some answers. So anything that you feel like is not right, I think that's a good reason to go see someone about it.
Awesome. Thank you. And Ruth, what would you like to share?
Well, I echo what Dr. Sarah said, and just one more point to add. There are a lot of other options out there besides oral painkiller. Okay, so just don't go for yourself, lock the door, and then have tears running on your face and keep swallowing a lot of painkillers. There are a lot of other options. Be optimistic.
Thank you so much. So we have, don't take no for an answer. Start with yourself. Seek help and explore your options. That's fantastic. And I think I want to summarize by referring to something Zara said earlier, when she said it really depends on whether you have a strong female figure in your life. And that can really, if you have someone in your life like that, really help if you are suffering from a gynecological health issue. So I think, therefore, the call to action for everybody on this panel, whether you are man or woman, no matter who you are, why don't we all strive to be that strong figure in our own lives, and in the lives of those we love and anybody that we interact with. Let's normalize conversation around vaginas, around gynecological health issues. You do not know the impact that just talking about vaginal health at a normal volume might have on somebody even walking past. I've seen this happen with menstrual health specifically, and I think it could happen with anything, be it endometriosis, Pcos, or cervical cancer. If we just talk about things and normalize them, you could really, really impact the lives of so many people. And you don't have to be a medical professional to do that. That can be done by every single one of us. So thank you to all our panelists. This was absolutely amazing. I could talk to you guys for hours and hours. I hope we can do it again soon. And to our audience, thank you so much for sharing your questions. Again, we will share all the resources that you need to contact our panelists or their organizations after tonight. Thank you and have a wonderful evening.
Good night. Thank you, Olivia.
Bye.